we decided to focus on creating a medical service for students that's catered exactly to them. I'm Sarah Dotzel.
I'm Patrick Keller. Bruce Heggie.
Tim Kunst.
Daniela, Tomas.
So, like the rest of our other groups, we also were posed with the question of how might we improve the health and well-being of students at Notre Dame. And we were encouraged to think as big as possible, so when our team came together, we had a plethora of ideas spanning fitness, medical health, nutrition, etc. And we got to talking about which direction that we wanted to go specifically. And since medical health is something that has affected each of our lives here at Notre Dame, and we feel perhaps the lives of every Notre Dame student, that's where we decided to focus. So getting into that process, the design process was very new to all of us because instead of starting with perhaps a potential problem or potential solution right off the bat, we instead took a lot of time up front to get to know our users so that we could then use their unmet needs to define the problem, to come up with potential brainstorming of ideas, and then take those ideas and prototype, test, and iterate them until we came up with what was the best solution. So as mentioned, we started by using empathy to understand our user needs. And we used a variety of techniques to do this, the first of which being ethnographic observations, which is kind of unique because it gives the researcher a chance to take the role of a learner. And we did this by each kind of taking some time and going to St. Liam's and kind of just like watching how our users were interacting with the experience. And we looked at the cognitive, physical, cultural, social, and emotional aspects that each user was going through so that we could come up with some of their, their insights and their perspectives with using this experience. And I'd say our biggest takeaway from this was just that the most amount of time was spent in the weight room, and the longer that people were there, the less pleased they were to be there. So I guess the emotional kind of went down as the process went on. Second, we went straight to ethnographic interviews because a lot of our users were unwilling to do kind of a user camera study since medical health is kind of a personal experience and it's not really the right place to take your phone through and take pictures. So we were able to gather some important insights from our interviews. And the interview process was important because we had to really focus on our methodology and making sure that our users were really comfortable to give us the most accurate and comprehensive information that they could. So this means interviewing them in environments they're comfortable, like their dorms or classroom buildings that they feel comfortable and are kind of a neutral ground. And also by asking questions that were open-ended and encourage some storytelling because you can gain a lot of insight from the emotions that they experience if they go into their story and telling how they feel that things happen. So I'd say our biggest insight from the interviews was that going to St. Liam's is often a long and inconvenient process that they feel leads to occasionally a unhelpful diagnosis. So this forms as a deterrent for a lot of people to go to St. Liam's. And in the crazy lives of students, they're trying to prioritize convenience over everything else. So to get into more specifics of things that we learned during the interviews, we made a short video of some of our more common, insights and quotes that we had. The only one that's missing is just that with the institution of the new $5 walk-in fee, a lot of students are kind of confused and annoyed by that. But other than that, these were our key insights.
I wish I go to St. Leo's because I don't want to walk 1,000 miles with the frozen tundra to get there while I'm sick.
I'm going to St. Leo's because I am about to have a wait list.
The nurses at St. Leo's are always really nice. It's like having a mom away from home.
Okay, so we scanned social media and the news to find some trends related to our topic. Start off with Twitter, and I hear some students obviously visited, and this is their response to St. Liam's is taking forever. There's even a sarcastic response, St. Liam's for the second time in as many days. I'm healthy. I just really like the atmosphere of this place. Says no one ever. We didn't find much on Facebook, but this is a very intense quote that maybe there's obviously an unmet need. This person says, "This is the third time this week I've called a suicide hotline and mumbled something incoherent and cried on the line. Apologized and promised them I wouldn't kill myself." We didn't really get into mental health, but maybe there is something that St. James can do for people like this. And then the news. Walk-in clinics are booming. Here at Wall Street Journal says urgent care companies popped up in the 1980s and have expanded faster in the past decade as emergency rooms have become more crowded and patients seek alternatives. Now, from our expert interviews, we interviewed 2 Notre Dame Health Service administrators, and their biggest challenges so far have been wait times, and this is across the country. Wait times is just not at St. Liam's. Setting priorities for who to see first and space. Currently, right now at St. Liam's, there are many different programs going on, from allergy, immunization, eating disorders, sports medication, etc. But they are looking to improve. The questionnaires you guys get after you visit St. Liam's email, they're actually reviewed every quarter to figure out what St. Liam's can do to improve the overall experience. Addition of walk-in specific positions will help reduce the wait times. Constant benchmarking with other schools, and then the $5 fee that many of you have complained about. A lot of students, not just you, but students in general have complained about, is actually to help you save money. So St. Liam's would have to charge students for the equipment that they use underneath $20, and in order to take that away, they're just charging walk-in appointments $5. And then health and wellness reviews, electronic medical records, and the go-to-dorm presentation. But bottom line, this is a quote we took from the interviews. We care a lot about Notre Dame students, and we work really hard at what we do.
Okay, so from here, we just took the insights we got from the first section of the empathy and started by creating user context and a value chain analysis. So the user context is kind of like taking all the things that we've learned and putting it together to figure out what our users' physical environment, what they think, feel, etc. And then also the value chain is just kind of the emotions that the user feels throughout the process from when they approach to when they leave. And then also we created a journey map to map out the highs and lows of the experience for our users. And again, all these things are just to help us kind of put everything on the table so that we can understand the insights that we've gained and look at them to move forward. And then finally, we came up with 4 personas, kind of spanning from injured versus ill, goes frequently versus never goes. And we plotted each of these people on this picture are people that we interviewed. So it appeared from our interviews that most people hesitate from going and go when they're sick. So that's kind of where we focused and tried to address those users since they seemed the most prevalent. Which brought us to our major insights from this section, which are, first off, that students desire medical care that is convenient, comprehensive, and speedy. Wait times are a major deterrent. A lot of the time, St. Liam's is the last resort for upperclassmen. We haven't covered that much, but like we showed in the ethnographic interviews, a lot of students don't want to go because of there's no place to park. So if you live off campus, it seems like more of a hassle to get there than it's worth. Fourth, the health center administration is aware of student concerns and is constantly working to improve, which doesn't seem to be known necessarily by our users. The health center is extremely confined by space, and again, there seems to be a communication gap.
And this brought us to the problem that we defined, which was that students need an on-campus solution that provides a quick and efficient process, but also operates within the constraints of the St. Liam's program. And so we developed some ideas for this. One of them was prescription deliveries. Like, students would register with St. Liam's for their monthly prescriptions, and then there would be St. Liam's individuals who would ride out on bikes or deliver them dorm to dorm, eliminating that need to constantly be going off campus to pick up their prescriptions or walk across campus to St. Liam's. Assigned doctors. Each student, this was a little bit more ambitious, each student would be assigned their own doctor on campus, just kind of thinking big picture, really serving each individual need. Vitamin C distribution, offering students oranges and vitamin C supplements during cold and flu season to try to kind of combat that, offering them at locations that were really busy, like the Bartolo, so that you could just quickly pick it up, try to just use natural remedies to fight that off. Also increased health awareness initiatives, just kind of advertising throughout campus on billboards, using things like stall notes, which are prevalent in some dorms. just ways to get students to kind of be more knowledgeable on how to prevent certain illnesses. House calls would be doctors visiting dorms and off-campus locations. Whenever students needed them, they would just call in, a doctor would come and meet them. Online appointment scheduling would be an application that would be developed. That would be an interactive calendar. Students could see what times were open, what times were available, so they could register whenever they needed, walk in and not have any wait times, just go right in, get treated right away. A second health center that would be built. St. Leon's is in a very remote location on campus, so a lot of students complain about walking from South Quad to West Quad all the way up to North Quad just to get treated for an injury that might need immediate attention. And finally, walk-in clinics. As we previously mentioned, they're very popular. They're on the rise. Many Walmart use them, and Target and other big box retailers are starting to implement them. You just walk right in, sit right down, get basic medical attention, anything basic that you might need, they can just serve you right away. We obviously narrowed these down based on certain constraints. The second health center was obviously a big financial consideration, so we assumed that the university might not be right, but get by that right away. Also, some were a little bit ambitious in terms of the reasonableness of being able to actually implement them, like house calls. So we narrowed them down on that basis and decided to focus more on walk-in clinics and the online application. And so with that, I'll hand it over to Tim.
All right, so after we met and came up with all those great different ideas, we had to take it into our prototyping phase. So we had met with our group and talked to some more people, and we really got a good feel of combining some of our ideas and coming up with a couple new ones into some rapid prototypes. So these ones are just our 2D prototypes, and the first one is the dorm docs where the doctors come to your dorm and things like that. And we were trying to decide if they could have a schedule or something. We came up with a little bit of a napkin pitch for all of our ideas, and this is kind of the one for the dorm docs. It talks about how our need is it needs to be more convenient for the students. That's a primary one. Our approach is we would really have to get doctors to agree to this, and the dorms as well. You need a spot in the dorms to do it at, for them to wait and have a room. The benefit is pretty clear. Everybody is in their dorm to get their service. They don't need to walk across campus out in the cold or anything. And there really is no other competition other than St. Leon's themselves with this idea. And then so some of our other ideas are a checkpoint. This would be located in different areas on campus, run by a nurse practitioner, and just be, you could check in and just do a quick little stop, and just for minor things like colds and things like that. Then we had the prescription delivery that Pat already talked about a little bit, where students would ride around on bikes and help deliver our prescriptions. And then building a second health center at a few different locations that we thought of. So then after we did this, we did a quick solution evaluation based on a couple of things. The user value criteria, we wanted to work on wait times, the walking distance, and the quality of service. And the business value, we were mostly concerned about cost and space. So we made a rubric for this and kind of graded each one of them, and the checkpoint one, as you can see, really stands out the best. And then so we took these ideas also, and we got some more feedback on them through our friends, roommates, other classmates, and we realized that dorm docs maybe weren't feasible. People didn't really want the doctors in their dorms, and a lot of people congregating around their room, a lot of sick people. So that just didn't really seem like it was going to work out. The legality of prescription deliveries by students, we tried to look that up, and it was a little hazy if we could really allow students to drive around on their bikes with thousands of dollars worth of prescription medicine. So that didn't necessarily seem like the best idea. And then building a whole different second health center would be extremely expensive, and Notre Dame, it takes a long time to get something like that going. You have to make sure the aesthetics of the building all work out, the location and everything. But we also get some great new ideas. People said that maybe if they couldn't come right to your dorm, something like a hotline or on Skype that they could talk to them about. And so we cut down travel for little things, but would still be very convenient. Maybe a traveling campus medical van. That was one idea that people had thrown out. And we really wanted to reconsider all the things for the off-campus students, especially with the parking and things like that. Now I'll pass it on to Daniela.
Yeah, from there, we went into our phase 2 of prototyping, which involved detailed sketches of our app mock-up, and then also our first 3D version of the actual checkpoint that we would suggest. So first with our app, we began with a login screen for students to enter their Notre Dame ID and then password, which would then take them to a home page with 4 main buttons, one being their prescriptions, wait times at the checkpoints around campus, a scheduling button to be able to actually make an appointment at St. Liam's itself, and then a general information button. We would also have a direct hotline, so someone would be able to access the doctor very quickly in that way. We would have a map on campus so they would know how to maneuver around, maybe if it were for a lower classman to get to one of these checkpoints or St. Liam's. And then also a contact button, whether they need the location or, again, the phone number. We also have our 3D model of what we thought a checkpoint would look like in the beginning. So we would have a person on a screen with a little keyboard and mouse so that people could check in right when they got to the checkpoint, a chair and waiting area, and then as soon as the nurse practitioner were ready, they would be able to come around back and then be served on the top screen over here with, like a little examination table and whatever simple tools were necessary. Our feedback on this was generally really positive. People liked the idea of an app. They definitely wanted it to be free for students. It should be simple. We also decided that 2 or 3 checkpoints would probably be optimal in really convenient locations around campus. So again, convenience is the main concern. People want a service to be accessible from wherever they live on campus or whether they live off campus. And then a new suggestion that we added in this prototyping phase was buzzers. So when someone checks into the checkpoint, they would be able to get a buzzer and then they could go do something productive while they wait for 10, 15, or 20 minutes instead of just sitting there and doing nothing. So this leads to our third phase, which are life-size prototypes. So we can start by actually scrolling through an app that we've made just in Excel, if I can see the mouse. So this would be the home page of our app once you log in. And then we can go check on your prescriptions. We can see this one's not ready. Go back to the home page, check on wait times at the different locations around campus, and then do various other things. So the hotline would look something like this. So those were our preliminary ideas for the app. And then next, we also created a life-size presentation of what a checkpoint would be for us.
Really happy that there's no way this checkpoint was on.
Thank you for checking in. Please grab your buzzer below, and the nurse practitioner will be with you shortly.
Just a side note, Bruce did get hurt in the making of that video. And then again, we did get positive feedback on this third phase also. Students thought that having a wait time function would be really helpful for them. They can decide exactly where they would want to go on campus. And then also the touchscreen interface would be helpful because we wouldn't have to staff another person to receive or triage patients. That would all be automated. And then we did add some new ideas. So we thought a confirmation email from either a checkpoint or St. Liam's would be really helpful for students St. Liam's could use that to deliver their surveys, but also students could use that to give proof to their professor, like, I wasn't skipping class, I really was sick, and this is why, because that's kind of a difficult process as it is now. We also thought St. Liam's history might be interesting if you do unfortunately have a 10-minute wait or 15-minute wait, something to do. The calendar interface for scheduling would also be helpful. And then we would, if this were to be implemented, we would want to be sure that students are very well aware of it on campus, so it's not an underutilized or wasted tool. And so we did get additional feedback from our survey. So 84%, which is a large percentage of students, think that this app would be really helpful for them. And also 81% of students said that they would really like to be able to call a doctor and have that hotline just for really preliminary advice. And then 86% that they would actually probably use the check-in clinic. And so some other interesting information, most students thought that the prescription pickup would be most helpful at 37%. At 48%, they said that having a checkpoint in La Fortune would be most convenient as opposed to other locations on campus. And in comparison to the app, the phone hotline, and prescription deliveries, they thought that the app would be most helpful.
Okay, so finally our recommendation, we used all this data that we've gathered along the way to come up with a solution that we think is really going to address our user needs. And it's most of the things we've been talking about, the St. Liam's mobile app with maybe the addition of an application for St. Liam's history, which people would just want to know, like when their past visits were to St. Liam's, or like any prescriptions they got to aid them in what they would tell the doctor this time around. But the checkpoint locations from our survey data we found would be in the X Center by the bookstore, in the new stadium, and in La Fortune, which was interesting to us because we assumed different ideas for the location, so it was really nice to have the survey data to know what the people actually want and not just what we assume. And finally, to address the awareness issue, this is kind of a long-term process, but something that we suggest doing right away is communication with all dorms at the beginning of the year, just having a quick 5 to 10 minute meeting, put a face to the name, maybe alleviate any animosity towards the health center, and give students some awareness of what all they're doing. So.
Are there any questions?
So your survey, how big was that sample size?
30 students.
30 students, okay. And how was it administered?
It was a Qualtrics survey that we emailed and used Facebook to get out.
Okay. So is it primarily your peers, people that would be seniors mostly?
Right.
I got a little bit from underclassmen.
Yeah, I think it'd be interesting. I mean, I love the way that your team kept sort of going back to the tools and how that co-creation helped lead to the next idea. I'd love to see, more user feedback to help define that you guys are on the right track. But I think it was all that.
Actually, I had 2 questions. Can you back up to the persona slide?
Sure. Might be able to.
Sorry about that.
It's okay.
Did you say, Bruce, you were hurt?
There was a stick. I got like a scar.
Sorry.
That's my bad.
Here we go.
Is that the different types? I mean, the most people are in the far right, and I apologize for those of us not in college. That's a little hard to read. Is that proportionate, though, to the population that you talk to? Is that where, okay, so that was kind of, that's the box down there where most people.
That was like the breakdown of our 25 to 30 interviews that we did.
Yeah, we kind of tried to fit them into a group that, I mean, it was just a short interview, but we kind of, just based on their responses, tried to fit them into kind of one of
So
the
it was easy
regions.
for you to see that the bottom right and bottom
Yeah.
is really where the bulk of your target is. The only question I had was, I got a little confused. Is the checkpoint concept the same as the research you did on walking clinics? Is that the idea of the checkpoint?
Yes, a checkpoint would be a walk-in clinic.
Okay,
Yeah.
okay.
Oh, yeah, sorry, that was.
All right.
It was just our like clever name for it.
Okay. I got a little confused on that, but okay, so you followed that all the way through the research out to the end. Okay.
Does anyone else have any questions? I know we got some folks here from St. Leo's. Any questions?
I wonder if you could use the app to like track diseases maybe like within campus, like if like, you know, the guys spreading or the flu or whatever. Just